I'm really excited about the Infini radio frequency treatment that we have started offering to our patients. I think the results are truly amazing. It is a radio frequency device and not a true laser. The way it works is that microneedles are pressed into the skin surface. The microneedle is insulated for nearly 90% of its length, and only the tip releases the radio frequency. So it can be very accurate. We can determine exactly the depth of penetration of the needle. And so the areas that I'm truly happy to treat are men and women with acne scars, with fine lines and wrinkles, and some sagginess. Areas that we're still evaluating now, but it's showing some promise, are stretch marks. And the last thing is it seems to produce some permanent reduction of sweating from the armpits. So axillary hyperhidrosis is also another indication. It's a radio frequency device and not a laser, so you don't need any eye protection when you have the procedure done. The last thing is that because it's radio frequency and not a laser, it is colorblind. That means you can have a tan. You can actually have a tan before the procedure, and within a few days go back and suntan again if you so desire. It's also great for people of color. So you can have brown skin like me or even darker skin tone than me, and it is completely safe and works really well. The last great thing is that the downtime is minimal. You will be swollen for about 2-3 days, and you may have very mild crusting for a few days, but literally you can go back to work after a long weekend in about 3 days, and people wouldn't know the difference. You will notice results and improvements starting in about a month, and it improves for 3 months. I usually recommend 3 treatments, approximately 4 weeks to 8 weeks apart, depending on the area. The procedure does hurt a bit when we do it, when you're having it done, and so I usually recommend a very strong topical cream that we apply when the patient comes in, and in some areas that are more sensitive, we'll even offer the patient a pain pill that they can take during the procedure. As soon as the procedure is done, absolutely no pain, and I usually have patients restrict activity for 24 hours, so no exercise, but otherwise you can go on your daily activities right away.